we might bring a patient down after we do the soft tissue and the adjusting. We might bring them downstairs and load them up, and we get a lot of patients that come down here like, this is really interesting.
We really strive to promote wellness, and in addition to the soft tissue and the adjusting and the rehab that we do, we talk a lot about stress management and sleep and nutrition.
Boom, we are back at the In the KNOVA podcast. What was our catchphrase last time? The more you know, the more you can live. Let's go with that one today.
I don't remember.
I like it.
I thought it was catchy in the moment, but apparently it's lost.
So today we've got Sarah and Mike Penkin, both Dr. Sarah and Mike Penkin of Pinnacle Hill Chiropractic. So let's talk about, well, we'll get into a bunch of things, but give us a background of kind of what you guys do, the type of people you see, and maybe like even what a day visiting Pinnacle Hill Chiropractic might feel like or look like if I was coming in to visit.
Cool.
So basically, we're, again, Doctors of Chiropractic. We specialize in kind of a wide variety of different issues that people might come up with. I really like treating lumbar disc issues and injuries, and specializing with powerlifters, bodybuilders, CrossFit athletes, athletes in general. But that's kind of my thing, is the lumbar disc issues. I've been a lumbar disc injury patient myself, and I've been able to do a really good job of keeping it in check and continue to train on my own without further injuring it, and actually seeing, you know, my performance like improve, which has been really beneficial. So that's kind of what I really like to see. Dr. Sarah?
So my specialty, I actually just transitioned my practice from kind of general wellness. So I was seeing male patients and female patients, but over the last few weeks, I've transitioned strictly to women's health. So I am only seeing female patients at this point.
Sexist.
It's actually because my continuing education that I've been taking has really been tailored to women's health. So I'm seeing a lot of prenatal patients, a lot of postpartum patients, kind of women who are trying to recover postpartum. Unfortunately, in the United States, you get one postpartum appointment at 6 weeks postpartum. And then from there, it's like, well, you can't do anything at 5 weeks and 6 days postpartum. But at 6 weeks, you can have sex and you can exercise and you can do whatever the hell you want. And that's kind of all of the guidance that postpartum women get in the US. So being able to help them transition through that recovery process to turn it into a rehabilitation process and then get them back to exercise is really what I love to do. And then female athletes as well. So I've actually been seeing a lot of runners lately. So I've been seeing a ton of different runners, which is a lot of fun. But yeah, a day in the life of our practice is pretty awesome. We see, you know, a full day of patients on a regular basis, and it's just nice to be able to get people feeling better, well, I guess you used to see smiles, but now in a healthcare office, you don't see smiles so much anymore. But it's really rewarding what we do on a regular basis, and, you know, seeing people start to recover and seeing people start to get back to exercise and things that they never thought that they would ever be able to do again. And that goes, you know, to CrossFit, powerlifting, running, postpartum moms. Like, there's a lot of people that have pain with their activities of daily living and never thought that they would ever be able to exercise pain-free again, or squat without knee pain, or squat without low back pain.
So a lot of times when people think chiropractor, they think like back injuries, just like Mike was saying, you know. But I know from working with you guys when I got hurt, you do a little bit more than that. You know, it's muscle, you know, injuries too, or clarify if I'm not.
Again, that's the kind of, you know, we're pigeonholed into this idea that we only treat the spine, and that's all we do is the chiropractic adjustment. But we can really go down the rabbit hole as far as different techniques go, but we encompass some soft tissue manipulation. We do the adjusting, we do some mobilization, we do a lot of rehab stuff, and we've actually been diving into more physical therapy continuing education courses, because we've kind of found that in our chiropractic education, we get some rehabilitation education, but I'd say it's
less than mediocre. It is not ideal.
And so we have a full movement studio in the lower level of our office, and we have We got a power rack, and we have
By
hundreds of
movement
pounds of weights.
studio, you mean small gym?
Yeah,
Yes.
yeah.
Okay.
And we have a small gym at our lower level, and I mean we have 106-pound kettlebell, and we got dumbbells up to 70 pounds, and so we might bring a patient down after we do the soft tissue and the adjusting. We might bring them downstairs and load them up, and we get a lot of patients that come down here like this is really interesting. Like I've never seen an office that has all of this equipment in there, and we've been really fortunate.
Well, today
in that
Kevin
sense.
came to our office to come check out our space, and we were down in the movement studio just kind of chatting, and Dr. Caitlin, who's one of our associates, she came down, she's like, I'm just going to borrow a kettlebell, like grabs a kettlebell, runs it back upstairs. All of our providers are comfortable using that space. So we have the opportunity to use it on a regular basis. I was down there with one of my patients today. We didn't use any weight, but I had some resistance bands out. We were doing some banded pull-throughs. Just a bunch of different stuff to get her glutes working a little bit better. She's been experiencing some urinary incontinence while running. She's 7 years postpartum, but she just kind of anticipated that this is something that she had to live with for the rest of her life. And unfortunately, a lot of medical providers will say, too bad that you had a baby. That's how it works. And too bad you had spinal surgery. That's how it works. Too bad you had an ACL repair at 17. That's how it works. So we really strive to promote wellness, and in addition to the soft tissue and the adjusting and the rehab that we do, we talk a lot about stress management and sleep and nutrition, and one of our chiropractors also has her master's in applied clinical nutrition, so she works with a lot of our patients who might be having some hormone imbalances or might be having some GI complaints or thyroid dysfunction, and is able to kind of put together meal plans and some supplements and some things that will help with what they're already getting as treatment on the medical side. So we have this really fully encompassing wellness-based practice is really the goal.
Oh, so you cover movement, nutrition, sleep, stress management. Gee, are those 4 out of the 5 factors of health that we talk about in this gym every single day?
Yeah. Well, I wanted to ask more about the physical therapy continuing education, because I remember, Dr. Sarah, you had a post recently on your Instagram about how a chiropractor appointment and a physical therapy appointment should look the same or look similar. Can you talk a little bit more about that?
Absolutely. So a lot of people think that when you go to the chiropractor, you get adjusted, and when you go to the physical therapist, you get rehab. And that's kind of how it works. But the way that our professions, both of them, are really starting to grow is physical therapists should be manipulating, and chiropractors should be doing rehab. And if you have a really good chiropractor and a really good physical therapist, you really shouldn't be able to tell the difference. So Nate Reynolds, he's a physical therapist.
Oh, yeah.
He's one of your newer members.
Oh, yeah.
I actually met him last November at a physical therapy conference or a physical therapy seminar that I went to in town. And it was really nice to kind of immerse myself into this PT realm where a lot of the physical therapists at that seminar were, I guess, naive to what chiropractic can be, and they have this idea that it's just manipulation and you're in and out of a patient appointment in 3 minutes. So getting the opportunity to educate those physical therapists on what we do and how we collaborate with physical therapists on a regular basis was just awesome. Actually, I thought that continuing education course that I took was so great that we signed up all 5 of our chiros to take another one by the same group in August, because we thought it was so well put together.
Yeah. Would you ever add a strictly physical therapist provider to your practice?
That's something that we've been we're super interested in, but it gets messy with New York law and how we can operate and scope of practice, and so
a lot of it's because of our state license.
Yeah.
We can't hire somebody who doesn't have the same state license as us unless their scope of practice is part of ours. So we can hire a massage therapist, but we can't hire a physical therapist, because even though what we do is so similar, it's still not similar enough that New York State says.
That is fucking stupid.
It's not
it's
great.
very
It's
odd.
not great.
Red tape.
Yeah, a lot
The
of
longer I live, the more frustrated I am with the bureaucracy of living.
So there's actually a bill that's being proposed to the New York State government about trying to, there's 2 bills. One is scope modernization, because basically our scope hasn't changed since 1967.
Your scope of practice?
Yeah.
Okay.
And we're taught to such a higher level to what our scope actually says. And then the other one is an MD-DC partnership bill, because basically right now we can't hire an MD and we can't even partner in owning a practice together, because there's a whole bunch of different assumptions as to well, if the MD, leaves the practice or passes away or something, then the DC is just going to start operating as a medical doctor. And
which obviously won't
no,
happen.
That's not true, right? So we're trying, the state associations are trying to push these things forward so it can, expand our scope and
allow us to hire PTs or an acupuncturist, because the same thing with acupuncture, we can't hire an acupuncturist because needling is not part of our scope of practice, so we can't hire them, which is too bad.
So it's an interesting dynamic, but yes, I mean, we're very interested in bringing in, we would love to have, an in-house physical therapist or something to that extent.
Interesting. The scope of practice thing. I think scope of practice is very important. I've seen it from other personal trainers over my time now that every personal trainer thinks they're a nutritionist or a dietitian. Every personal trainer thinks they know how to. Not everyone. I shouldn't say that, but a lot of people think that I'll diagnose. I know what's wrong with your knee, and I've tried. The more I learn, the more I realize I don't know, and then I try to avoid doing that to people. A lot of times I tell them, my scope is to keep you from getting hurt. There's a chiropractor you should probably talk to, or talk to your doctor first, see what he says, and he's probably going to refer you to see someone. But it's just funny that it's imagine not being able to hire a powerlifting coach here at this gym because their scope of practice is not the same. Right. And just this kind of sounds like what you're talking about. And I'm I can't hire a yoga instructor because I'm not a flexibility expert.
The realm of
it just seems silly
of fitness, but yet it's nope. That line is drawn in the sand, and you can't cross over there, and you can't come over that.
That's just interesting. Anyway, so people typically, unless you're doing preventative work, which is not a bad thing, don't see you unless they are injured. They probably come to you for the first time at least with some type of ailment, injury. I mean, what do you see? And if you could kind of maybe particularly to the CrossFit world, what are the types of injuries you see most commonly, or the problems you see most reoccurring?
Shoulder impingement.
Shoulder impigement's a high one. Is a really, really frequent one.
Mm-hmm.
Low back injury is another one.
Lateral hip pain.
Hip pain. I mean, those are the kind of the big three: shoulders, low back, and hips.
Yeah.
And if you think about CrossFit and the demands that it requires, it makes a lot of sense, right?
Yeah.
And so those are definitely the three.
I think it has a lot to do with people not realizing what their fatigue is. So obviously CrossFit is, how much weight can you put up for time? And if you're not having a really great coach like Matt, who is wonderful, and I came to a class here last week and it was awesome, but if you don't have somebody that's kind of paying attention to those things, I could have snatched a barbell much heavier last week than I did, and I probably would have been gassed and my shoulders would have been really sore and I probably wouldn't have felt very good, but you made us test what we should have started with beforehand, which I thought was a great exercise to just begin with, so that that you're achieving the correct stimulus and not crushing yourself.
I always like to say, and I think a lot of the other coaches say the same thing, it's we're going to do as many rounds and reps as as fast as we can, or I will say we're going to do this workout as fast as good form allows. And if the form breaks down, you're going to slow down or lighten the bar, period. I'm not going to let you just flail through this. I mean,
we're not looking people might.
I know. I've probably even allowed things in the past that I just wasn't aware of, and you just learn. But that's what we're talking about, continuing education. That's the reason to do it. You start to, when you do continuing education, you realize all the things you didn't know. You start to see, things you didn't know were happening, all of a sudden are right there in front of you, but you weren't aware of it beforehand. Okay, so of those big three, can you give me a few things that are just the number one things we should be doing to prevent those big three injuries from occurring or reoccurring, or not making them worse if they do?
I'll start with shoulder impingement if you want to do the lower body stuff. So when it comes to shoulder impingement, a lot of times people notice it with snatching, clean and jerks, even dumbbell snatches, anything that's overhead where they're not stabilizing well enough through the scapula. Because what happens is your humerus is literally jamming into your acromion process, and your supraspinatus is this tiny little baby muscle, rotator cuff muscle, that runs through there, and you're just constantly raking on it. So it's getting inflamed, it gets sore, people sleep on their sides, it aggravates it more. Everybody has this terrible, terrible, shitty forward rounded posture, which is just causing more stress to the upper back.
We'll sit up now.
Yeah, we're all like, ooh, yeah.
This is the only time I can just sit down all day. Like, I don't know.
But, those types of things.
Pinch the shit on my shoulder if I want.
And even if people are doing, like, a strict press with a barbell, they're coming overhead and they're like, I can feel it. And then as soon as you get them in a front rack and you say, like, roll your shoulders back and down, stabilize, and then go overhead, they're like, wow, my shoulder pain went away. Because you're not jamming your humerus into that muscle and you're not just constantly re-irritating that muscle. So, things like crossover symmetry are great. Heavy farmer carries are awesome. Just to get that lat activation, get that lower trap activation.
Are things like, scapular pull-ups, scap push-ups really good?
Oh yeah, those are great too. A lot of people have a hard time with those because they're getting a lot of extra movement through the elbow, through the wrist. If they can't dissociate their scapula from their thoracic spine or like from their rib cage, it tends to kind of just look a little wonky.
Those types of scap retractions, scap pull-ups, things like that, it's 4 out of 6 classes a week we end up doing those in our warm-ups. Our coach, it's just, preventatively, and then obviously, as people progress to doing even trying a pull-up, that's obviously an essential part. So that in combination with setting that shoulder blade down to control, learning to retract.
Right.
When you teach people scap push-ups, you get them either against the wall or on the floor on their forearms, right? Because then it takes their elbow a little bit out of it.
You get rid of the wrist, you get rid of the elbow. It's a little bit easier to prevent that external rotation, because that's the thing that everyone does usually is they internally rotate and then they shrug,
right?
As opposed to actually keeping everything really locked in place and protracting and retracting. So when you get them to keep the forearms parallel on the wall, that eliminates a majority of that aberrant motion that you don't really.
And you don't have to load as much either to fight with.
Yep.
Oh,
yep.
That's a good idea.
And then another stat is, if in general rotator cuff tears, I want to say the stat is roughly about 90% of rotator cuff tears are a direct result of scapular dyskinesis, so poor movement of the shoulder blade. So now you take the general population, where again 90% of rotator cuff tears are due to poor movement of the shoulder blade, and then you start loading them in a ballistic or a dynamic movement, and it almost is like a recipe for disaster. But again, it's something that you can be very effective in if you can eliminate those aberrant motions and really teach people how to be more comfortable moving their shoulders.
Sweet. It makes me feel good to know that, hey, we're doing something right.
Yeah. Absolutely. Right. And I think those types of warm-ups where you're going to be including some type of like mobility activation based stuff like that is going to be huge. It's going to give people that little cue and be like, oh yeah. But even just telling people, roll the shoulder blades back and down, stabilize well enough, like ribs over hips, shoulders rolled back and down. It's just going to make a huge difference. Like I have a patient, she came in recently and she's like, every time I heavy deadlift, I have like really bad neck and like upper shoulder pain. And I was like, do you roll your shoulders back and down, like stabilize like with your lats before you deadlift? She's like, what? No. And I was like, oh, okay. We're going to talk about that.
Do you hear this, people? I did not pay her to say all these things. It's the same shit I say in class every day.
Like, you shouldn't have pain after exercising. And, like, going into the low back pain one next, like, you shouldn't have low back pain after deadlifting or squatting. If you are, something is a little off.
Yeah.
And a really good coach can probably help you get to the bottom of that, or a really good chiro or PT.
Yeah, so let's go into the low backs.
So this is something that I can really go off on a pretty long tangent. So
this is like Mike's nerd stuff.
Keep me on track. But so I'm going to basically talk about squatting in general, because squatting is obviously used extensively in CrossFit. There are a number of different squat movements that happen in CrossFit. Squatting has a number of different prerequisites in order for you to actually do it successfully. You have to take into account somebody's torso length, their femur length, their tibia length, their ankle dorsiflexion, their hip morphology.
Dr. McGill right there. I've watched a lot of those videos.
Yeah. And Mike did a 4-day huge training with him.
3 seminar series, 4-day intensive. And not everyone can squat the same, and not everyone can really squat, let's say, ass to grass. And it's not necessarily appropriate for everybody. When I have patients that come in with really severe low back pain and they're worried about squat depth, and I say, are you competitive? And they say, well, no. And I say, okay, the only depth you have to worry about is squatting off the toilet, because that's basically the deepest you really have to be able to do in everyday life. But anyways, so a lot of low back injuries that we see are either lumbar paraspinal strains due to maybe excessive rounding in the back during squatting. The very scary butt wink. And
so on that, so I've seen mixed reviews on how okay or not okay the butt wink is. Sometimes I've heard if you're dropping fast or trying to bounce out of the bottom, very dangerous. If it's under control, not necessarily wrong. What's your...
So I'm of the stance that butt wink is bad.
Butt wink's bad.
Butt wink it's bad. And that, if you look at, again, you have to look at the discs specifically, right? The lumbar intervertebral discs. In one of Dr. Stu McGill's books, he referenced an experiment in which they took pig vertebrae and they flexed them under no load, and they were able to do full cycles of flexion, I think up to about 80,000 repetitions before there was any damage to the disc. And then they loaded it, let's say moderately. And I don't remember the numbers off the top of my head, but it dropped it to about 20,000 repetitions of full flexion before there was noticeable damage to the disc. And then they loaded it even more, and it dropped it to about 5,000. So I'm of the mindset that butt wink is bad. You want to make sure that you're staying just above the point in which those hips are going to start shooting posteriorly, and you get that. Because, again, and that's, I might be biased because of the education that I have, and then my also personal experience. Like I've had a really severe disc injury that was debilitating, and
so is the butt wink tend to be caused like purely by like skeletal anatomy, or how much of the muscles and tightness and things like that play a role?
It's a combination of just about everything, right?
Okay.
So you're again, if you have somebody that has, we'll just look at ankles. If you have somebody that has really poor ankle mobility, very poor ankle dorsiflexion, they're going to bottom out quickly with that dorsiflexion. And in order to get depth, they're going to have to shoot their hips backwards. And in order to maintain balance, they're going to have to anterior torso lean. And you're only going to be able to lean so much until that spine starts to flex, right?
Yep.
And then, boom, there's your butt wink. And it might not even look like the butt is winking, but the torso is leaning forward, right?
Yep.
If we look at hip morphology, right? If you have somebody that has... And again, another thing that McGill talks about is the different shaped hips. You can have what's called a Celtic hip, which is a very deep set, boxy hip, doesn't allow for as much range of motion. Or you can have a Dalmatian hip, which is a very shallow hip, which allows for way more range of motion.
Why is it called a Dalmatian hip?
Most likely due to the rate of hip dysplasia. Because it's such a shallow hip socket that there's more movement. You see it a lot in Eastern European countries. You see it a lot in China. If you look up how many gold medals China has in the Olympics, they have tons of gold medals. And if you look up
weightlifting,
Olympic weightlifting, and then if you look up how many Scotland has, I think Scotland has about 2 gold medals in the last 60 years.
Oh, okay, more than I would expect.
China has gold medals every single year.
I remember I was at a seminar with Mike Berger, the Olympic lifting coach at CrossFit, and I was asking him, like, is there like a certain genetics, a certain type of person who's just better at weightlifting? He goes, Asians. That was his answer. And I was like, oh, that wasn't quite what I was. He's just like, yeah. And then he explained basically the same thing. He's like, their joints are lined up different. They bend better. Anatomically, they just are better lifters. And I was like, yeah, fair. But
squatting's much more prevalent in their society too. Right, like as American society, like Western culture. Yeah, we start sitting at 6 years old.
Well, I mean, you're sitting in your high chair the day you're brought home, or whatever, more or less. You can
2
months so you can sit up at it all. Yeah,
we're sitting there. We sit through 12 years of school. We sit possibly through college, and then if you get a desk job, we sit. You lose that ability to actually squat.
Yeah,
and it's extremely detrimental. And so, a lot of times I see patients and I was like, if you know anybody that's got like a 2-year-old, you watch them squat and it's amazing, right? And it's just natural. They just do it. No one's coaching them how to squat. They just do it. And I'm in my head, I'm like, don't let them lose that
Yeah.
Don't let them lose it. And so anyways, we got off on that tangent.
Yeah, that's good.
So basically, again, with a deeper, that deep boxy hip, what's going to happen is that the femur is going to flex and it's going to hit the rim of the acetabulum, and that's it. Right there that's the end of the squat pretty much. I mean, you might be able to play around with, externally rotating the femurs a little bit, just again based on hip morphology. You might be able to get a little bit more range of motion. But again, once you bottom out that hip, that's it, and that pelvis is going backwards whether you like it or not. Mm-hmm. And so the idea of everyone being able to squat ass to grass, I would argue that it's not.
Yeah.
It's not feasible for everyone to do it.
No, yeah. I mean, even if you can squat ass to grass, it's not really a great idea anyway, right? Just general torque and stuff, dropping so low so hard.
Well, again,
there's a certain
goes to whether you're loaded or not, right? Like you can butt wink. I'll say this: butt wink is fine if you're unloaded, right? I don't really have major issues about that with if you're just doing an air squat with no weight, you're not really going to hurt yourself. But once you start loading, that's where the risk comes in.
Mm-hmm. Okay.
So.
All right. So, now seems like you treat a lot of athletes. Do you still notice anything more significant, anything, I guess, in general, with the CrossFit community versus average people? Problems like people may not be fitness enthusiasts or even very active or healthy that are different, or is it just kind of everything evens out in the end?
I think that a lot of CrossFit athletes that are coming into our office, obviously, like, we don't see a ton of elite CrossFit athletes, but the CrossFit athletes that are coming in, I think a lot of them don't know how to brace well. And I think that really contributes to a lot of the discomfort that people are having, because if you're not bracing well and you're not, utilizing your intra-abdominal pressure in that core canister well enough, like, something's got to give. And if you have a leak in the system, like, your low back's going to give, your pelvic floor is going to give, something's going to happen.
Fairly sure that Mike is the person who showed me where you're going to lay on your back, brace with the belly, and then you take the ab roller and jam it into my belly, and I have to brace against it. That was you, right? So lay in the back, like chest breathing, and then there's belly breathing. You're teaching me how to belly breathe. Yeah. I think you took something, maybe it was a pillow in your office or something, and then you basically, or maybe it was even your hand, but like I'd belly brace, and then you'd squish my belly, and if I could fight it, I was bracing my belly. If I wasn't, I was.
That's making me cringe a little bit to think that I used to.
I mean, it worked. I learned what you meant.
Nowadays,
this is like 6 years ago. I
just give a gentle poke to see if those muscles are firing, as opposed to jabbing something.
Well, I think your clientele just got weaker. I could handle the stabbing elbow.
Back in the day. Yeah. Back in the day. That's so funny. But I think that's like a really big thing, and I see it with my female patients too. Like, the way that females are taught to brace is this like bearing down type of pressure, which when you're postpartum, like, your pelvic floor can't withstand that, so there's a lot of things that I do differently with some of my patients than Mike would do with a lot of his patients, just because of what they've gone through in their life. But I do think that bracing is a big thing.
You had mentioned the females have a lot of issues with bracing. I think the idea of hollowing, drawing in the belly button, I think is a horrible idea. I think it's a terrible way to actually build tension.
To brace while lifting,
yes.
Or just as a physical practice?
So, I think
to brace while lifting, would not be. I believe that is definitely one of the ways I did hurt my back before. I somehow got into this idea of bracing by tucking in tight. I don't know how I got into that, and that led to tweaking something in my back because my lower back was compensating. Obviously, the belly breathing and bracing that we typically cover when breathing in class. And I do that little drill with the foam roller on the belly just to help people understand the difference.
Dr. Mike taught me this.
Unless Dr. Mike didn't teach me that and I was just someone else, but I could have sworn because it was to help me brace better when my back was a little tweaked up. But anyway,
that's funny.
I forgot where I was going with that,
but yeah, I think bracing's a big one.
Bracing's a huge one. I think with the CrossFit community, I think one of the biggest things is CrossFit. Obviously, it's very community based, right? And it's fun and it's social, but it's also competitive, right? So when you're working out next to somebody and they're going hard and you want to keep going, and I think it's knowing when to kind of tap out and understanding it's like form's starting to go, you should wrap it up, right? Because it's when you overreach, right? And you're really trying to push either the weight or you're really trying to push a couple more reps. That's where you get into the territory where injury starts to become a major risk.
We try to make that not as culturally normal, that kind of idea of like compete. Like, I think a bunch of us bust each other's balls. We try to outdo each other in this and that, but not at the expense of like
your body
looking like crap. When you're doing a movie, no, I mean you can PR a snatch, but if it looks like, oh my god, that was almost a CrossFit fail video, we're not gonna reinforce that very well. But I'm just thinking about our people, and I was like, oh well, I don't think we have too much of that going on, but I've definitely been part of the person I'd be the guy who would push myself beyond safe. Especially when I had mobility problems, like, in that front rack position, and you start catching max load cleans or max load jerks for reps. Oh my god, my poor elbows.
Yeah.
Things.
Yeah, it can be really detrimental, So that's something that I will be the first to admit. I know exactly when to tap out. Like, I have no shame whatsoever. If I start to approach that kind of point of no return, that's it. I'm done. Nope, I'm not risking it, because I've hurt my back more times than I care to admit, and I'll be laid up for weeks sometimes.
Yeah.
And it's not worth it just to try and get one more rep. I'd rather.
We were kind of just talking about that with the 5 a.m. crew too, like knowing your body.
Oh yeah.
Knowing like how you feel that day, how you slept, what you ate the day before, and like how that affects how much you can lift, how fast you can go, how hard you can go.
Absolutely.
Well, and that goes into like fueling your body too. Like, what are you eating? Like, if you're eating like hell and then you're trying to hit a PR the same day, like, is that smart? Or if you're not eating enough at all, like, I see that a lot with my female patients. They're like, everything hurts and I'm really tired, and
I'm not losing weight now.
And like, I'm gaining weight and like, I can't lose weight. What's going on? And then you find out that they're eating 1,200 calories in a day. You're like, oh, girlfriend, you gotta eat more food. Especially if you're running miles in a day, or you're doing a CrossFit class every day. Maybe we need a rest day. Maybe we need some more complex carbohydrates.
I can't even believe a human can stay alive on 1,200 calories. I eat well over 3,000 a day, and a lot of times that's under eating for how active I have to be. So when I think 1,200, I'm like, you mean breakfast?
I'm like, I made 1,200, after lunch.
There's postpartum moms who are breastfeeding, so they need to eat like 500 additional calories just to create enough breast milk and like fuel their baby. Plus, if they're getting back into exercise, like once it's safe and they're in intense exercise of some sort, and they're burning all of those calories, they need to eat even more. And when they're only eating 1,200 calories, like, there's not a whole lot left.
Oh, yeah, that's a good point. Okay, so a question I'm just curious to hear your guys' opinion on. So, like, sometimes you hear chiropractic practice medicine. I don't know if that...
Chiropractic practitioners?
Yeah. Chiropractic in general.
Sometimes people don't take it seriously. They refer to it or treat it like a taboo voodoo science, and it isn't always believed in. And I'm just curious more than anything, like, kind of like your response to that, or how you would... I'm aware of the CrossFit's shortcomings, and I know the taboo around it, but I think in some ways not the same for the same reasons or anything. Chiropractic at times has almost a taboo understanding in society. And I'm just curious on how you address that, or if you clarify anything like that.
You can go to 10 different chiropractors and have 10 wildly different experiences, right? And you can really kind of go down a rabbit hole with the way that some people practice. I mean, there are chiropractors out there that believe that you can prevent cancer and you can prevent diabetes just by adjusting the spine. And there's no literature to support that. There's no evidence to support that at all. And I don't think that there ever will be, because I don't think anyone would sign up and say, hey, I'm stage 3 pancreatic cancer. Let me sign up for this chiropractic treatment and see if it'll cure my cancer. It's not going to happen. And then, there's the other end of the spectrum where people want to have, limited prescriptive rights and be able to prescribe maybe some muscle relaxers or some NSAIDs or pain relievers or whatnot. And that's all well and good if you want to get the proper training in order to do that. It's not something that I'm interested in. It's not something that, I don't believe you're interested in that.
Nope, not really.
But, we do there are some chiropractors that believe that we should only be adjusting the spine. There's some that believe that you should only be adjusting the first cervical vertebrae. There are some that only do soft tissue and only do rehab, or only do, I don't want to say only do electric stim, but some that rely heavily on electric stim or cold laser therapy. And so
I think the big thing when you talk about, it's a taboo, or like people think about it as like witch medicine or like whatever, those types of things. Unfortunately, the chiropractors that are in our profession, we'd call them like a vitalistic or philosophical based chiropractor, they tend to be the loudest in the profession. Like they are the most passionate people you will ever meet about their profession. But unfortunately, not everybody has the same way of thinking. Like Mike said, you could go to 10 different chiropractors and have 10 wildly different experiences.
Sweet.
We're one of the only professions where if you have a bad chiropractic experience, you will never go to a chiropractor again, and you will tell everybody. If you have a crappy dental experience, you will find a new dentist. It's just...
You ever had a bad haircut?
You'll find a new hairdresser.
Never go to a barber again.
Yeah,
Never. I'll do it myself the rest of my life. No, it's you go and find another barber. And again, we're a very funny profession in that's kind of we're the only one that people experience that.
And our goal is really like, how many medical providers and other people in medicine can we educate on why we're different? Like why what we do is different and why it can be better than the last guy, And that's why we develop these relationships with physical therapists like Nate, and with other nutritionists and acupuncturists and medical doctors and orthos and neurosurgeons. We've been in practice I've been in practice almost 7 years, and Mike's been in practice 8 years. So we've been able to take this time to develop these interprofessional relationships so that there's other professionals in town that trust us and believe what we're doing, and we're able to show them the literature and give them true results that patients are seeing, and patients are able to tell their friends and their providers and everybody, like their coaches. So I think that that's really like what sets us apart, and our goal is to try to educate providers so that they don't think what we're doing is witch magic.
Yeah, that's a fair assessment of any kind. He's like, I know in the CrossFit world, there are gyms that are awesome. I think there's actually several in the city, Rochester, in the area, that do a great job. A lot of the times, people that weren't doing the best of jobs haven't, it's probably in any profession, whether you sell Italian food or do CrossFit or chiropractic, if you don't do well, you don't last. But there'll be people that do last that are off. They're just a little different, or they're not as professional as they could be for the clientele they're trying to serve, and it puts a bad taste in the mouth to people. And I've had people say like, "Oh, I hate CrossFit. I'm never doing CrossFit again." And I would say something along the lines of like, "Oh, that's okay. And it's not for everyone. Where did you do it?" "Oh, I don't do it. My brother did it, and he hurt his shoulder." And I'm like, "Holy Christ!" All right, so you just have an opinion on something you've never actually experienced.
Yeah.
So,
oh yeah.
And that's a lot of the stigma with chiropractic too, is you hear about stories in which my cousin's brother's uncle's nephew's former roommate had a bad experience one time, so they're all bad.
Yes.
And
yeah.
But we're chugging along.
Yeah.
Cool. No, I mean, I know, especially when we were talking before the thing about some of the continuing education stuff, that's stuff I value to the utmost in any profession. Like whether you are selling Italian food or if you're a chiropractor or a trainer or
now
anything.
I want Italian food.
Yeah, I know. Well, I don't know why I'm using that example. Maybe it's because I'm hungry. I did eat like crap yesterday all day long. I shouldn't be hungry for about 48 more hours, but yeah, no, I think you guys are on the right track. That's awesome. And the idea of working with other people that are out of your scope, that's something I've been trying to expand more into, and just kind of lean on other people that are better at this. Even in the sense of like, I'm not going to be a good yoga or flexibility reference. Like, I do enough to keep me healthy level of mobility. If you really want to practice yoga, the best I can do for you is refer you to Ramwad or a yoga instructor that I know. Like, and we provide Ramwad for all our members, but I think that's huge. Probably, and knowing you guys now even a little more than I already did. I mean, you guys are pretty much the only chiropractors I refer people to anyway, because I've seen you multiple times over the years, and my wife goes to you all the time too. But knowing all this now, I'm like, even more confident in like, hey, you should go see this person because I don't know.
We also, like, you guys know so many things that we don't know, and Mike knows so much that I don't know, and I know a bunch that Dr. Caitlin doesn't know, and everybody kind of in our office has our own area of expertise, and we've been wanting to continue to build our referral network and our, referral base with coaches around the city and yoga instructors and spin instructors and all of these people, because eventually somebody's going to come into our office and say, hey, I want to switch up what I'm exercising, or I want to try a CrossFit gym, and we want to be able to be like, these are your options. This is who you can see. This is why I really like X, Y, and Z. I sent Nate here because I was like, I think you should go to KNOVA.
Yeah, I like Nate. He's a good guy.
Yeah, Nate is a good guy. But, things like that, we really want to be able to tell our staff and have our patients understand that we don't know everything.
Yeah.
But we will send you to somebody or get you in touch with somebody that can help you. We are not the masters of everything. And we are the first people to admit that. Because I'm not going to keep you in my office and be like, oh yeah, I can fix you, and this will be great, and this will be great, and it's been a year and a half, and you're like, I feel the same.
You ever have like one of those continuing education seminars and you leave it and go like, I don't know anything.
Yeah.
I thought I knew so much, and now I'm back at the bottom of the mountain again.
Last year, I call it my midlife practice crisis. I started taking physical therapy seminars in women's health, and everything I had learned as a women's health chiropractor was like completely wrong. I was like, holy shit, what have I been learning over the last 5 years? But outdated, sure. Severely outdated. And I kind of sat there and was just like, holy hell, now what do I do?
Yeah.
Oh my God. So it was a lot, and so yeah, I know that feeling.
Yeah, it's the more that you learn and educate yourself, and it's like you start to figure out the more you don't know.
The Dunning-Kruger effect, is that what it's called? I think, where a person goes from feeling like they know stuff, the less they know, the more confident they are.
Yes.
And then when they learn more, their confidence actually goes way down.
Absolutely.
And then they start to build it back up, and they get more confident, and then they learn a new scope.
It's like a new grad coming out of school, and you're like, I know everything, and you're like, ugh.
Yeah.
I feel like I'm just perpetually in that kind of that lower portion of that curve.
Yeah.
Then I learn a little bit, and I come in, I learn a little bit more, and then
I feel like every 3 to 6 months I open up a new door to this profession that I go, fuck, I don't know anything again. What am I going to tell the members?
It's hard.
And
but that's what makes you good, though, is because you question things and you don't have.
You're not set in the same answer all the time.
You have a logical thinking brain in which that you can understand that you don't have all the answers, and that
is okay.
The tool that you have, it might not be appropriate for the job at hand, right? There's a saying: if the only tool you have is a hammer, everything starts to look like a nail, right?
Yeah.
So we have been able to develop kind of our own internal team with our chiropractors and our massage therapists, but then we also have our external team that consists of, we have a naturopath that we associate with, we have a couple different health and fitness companies that we associate with, whether it's CrossFit, personal training, bodybuilding, powerlifting, you name it. I'm getting into strongman just now. I'm actually going to be doing a competition in a couple weeks. So if someone wants that fitness aspect, we have someone. Boom, we got a guy. We got a girl. We got somebody that is going to be really good for what you're looking for. And then we have acupuncturists that we can refer to. We have other massage therapists outside of our own practice that we can refer to. So we've been able to really kind of grow our team, both internally and externally, and basically figure out, okay, what's the best solution for this person? Because it might not be us. And again, it's not the end all be all. And that's something that, going back to taboo, there are a lot of chiropractors that believe they're the end all be all, and it's not, and we're not, right?
No, yeah, I completely identify with what you're saying. No,
well, I was going to ask too, when you have an athlete, I've been to physical therapy, I Irish danced for 20 years, I had shin splints for a really long time, ran track, all the things. I would go to the physical therapist or the trainer or whatever, and they'd be like, yeah, you just need to stop doing what you're doing. How often is that? Are patients saying that they saw someone and they said I just I'm getting a second opinion maybe because X, Y, and Z said I should just stop what I'm doing?
Oh yeah, I've had patients come in and they've said, oh well, I have low back pain. I was like, okay, well, I want you to squat. Let's do a box. Oh, I don't squat. Why don't you squat? Well, I have knee pain. Well, you probably have some knee pain because you don't move. You know, like that's why we have pain.
Yeah.
Motion is lotion. Like as cheesy as that sounds, like the more that you can move,
you stop moving, you stop moving.
I'll be saying that first class I say.
Yeah, like the more you can move, the better it's going to be. There is, I would say, very rare instances where I would say like, take some time.
Yeah.
You know, but that doesn't even mean like, don't do anything. That continuing education course I took in the fall, they said, you know, the best way to get inflammation out of your body is to use your heart as a pump. Like, get your heart rate up. Whether you're a physical therapist and you have like somebody on an arm bike, whether you put them on an assault bike and you just have their heart rate going, you can go on a brisk walk, go on a hike.
10-minute interval walks.
10 minute, yeah, like anything like that. Like, get your heart pumping. Like, use your heart as that pump and as that kind of drainage system to really just help get that inflammation out of your body, which I thought was awesome. Yeah. You know? Why tell a patient that has acute pain, sit down and don't move?
Yeah.
You know, it makes absolutely no sense. So I think that there is very, very rare instances where I think telling somebody to rest is appropriate.
Or you take that patient that went to their, let's say their primary, and the primary just says, well, just don't do that anymore.
Right.
You know, if you have something that you love doing, and it's been a huge part of your life for a number of years, and they just say, well, you can't do that anymore. It's like, wait a minute, what? Like, I'm just supposed to stop?
Well, especially like a competitive athlete, like you can't really tell someone like just stop liking doing that.
I mean,
forever.
You mean like stop doing it permanently? But like there are times must be where overuse injuries.
Yes.
You need to just chill for,
you need to stop for
4 weeks or
stop for a week. See how you feel after. Okay, you're still not better. Keep it going another week, right?
Yeah.
I tell patients all the time. I'm like the last person that's going to tell you to stop doing stuff, right? Because that's so discouraging. It's so disheartening. And there's research out there that there's a pattern called fear avoidance behavior, basically. So if you have an injury, you have a painful experience, if you have low self-efficacy, you don't handle the pain well, you try to do something that hurts, so then therefore you don't do that something, and then basically it becomes a cyclical thing, and you just go round and round and round, and slowly but surely the spectrum of things you can do starts to shrink, right?
Yeah.
And now you can't do things because it hurts, right? Or you have a painful injury and you have high self-efficacy. You understand that it's painful, but it's not going to be permanent. That leads to the road, that's the road to recovery, right? So
it's like a huge biopsychosocial aspect.
Yeah, when you're hurt, I mean,
totally.
you could be hurt for maybe you're actually in pain like 5 days. But it feels like forever. Like everything you bend over, you try to touch, you reach out in front of you and you're whatever's bothering you. Because when I've hurt my back, I mean, I don't think I was in pain more than like maybe like 2 weeks. I was finally like, I think I'm okay. But that 2 weeks, I thought my career's over. I'm not going to be able to personal train people anymore. I'm not going to be able to do any of these things. Like mentally, I was like, this is crazy psychology. Imagine being an NFL player and you tear your ACL or you break your arm for the third
look at
time.
Sarah Sigmund's daughter. Like she was getting ready for the season and she tore her ACL.
Yeah, I mean, gosh, the mental depression that must follow, or
She tore ACL after she dropped out of the games last year for what? Broken ribs?
She had a fractured rib.
Yeah, she fell on the muscle-up bar or something.
So that was either last year or the year before. Like, she's had a rough season over the last
She's been hurt before that, too, I believe, too. Yeah. Oh, anyway. So I did have one in particular question. I have a client, personal training client. I've trained for a long time. He's a big yoga guy. But he's got scoliosis. And so when he doesn't work out and lift weights, he gets a lot of pain coming back. When he just stays on a routine of lifting. I don't know how normal that, other than, he doesn't seem to get much general guidance from his primary doctor. I was just wondering, maybe any things I should know or could know about scoliosis, how to keep a person from healthy and not getting worse.
It depends on the degree, right? It depends on the patient's age.
40s, and I would estimate pretty noticeable.
Yeah. So again, that's obviously the curvature is probably it's permanent, right? You might be able to make some improvements.
Okay.
But so scoliosis is it's interesting because it's not just it's not just a side to side kind of curvature. It's a triplanar issue, and so you have to take into account the vertebral flexion, rotation, and lateral flexion that all accompanies that. And so there are ways that you can kind of train the different muscular slings a little bit to identify. You have to identify which slings are maybe not working appropriately. And there are some different techniques. It's one thing that I'm not extremely well versed in, but it's something that I've looked into recently. There are a couple different techniques that can be utilized to really make pretty huge advancements in scoliosis. The biggest key for that is identifying it early. Yeah. And I'm sure
I think it's something he's had since he was a young kid, teenager.
Yeah. Well, we're all relatively the same age. I mean, I remember being in elementary school and they come in and they do the scoliosis check when we were 8, maybe, or something like that.
Yeah, elementary school.
And that's it. Yeah. And realistically, I was...
It can progress after that.
Well,
as a kid, did anyone else go, what the hell are we doing? That whole thing was happening?
I don't know if in Canada they did that. I don't
remember that. There's data to show that we should be doing it as early as, I believe, 18 months or 2 years old. And then monitoring progressively. Because it happens very early.
So within the context of the gym and as a trainer, is there anything he should definitely avoid doing or things that could make a situation not good?
Honestly, if he feels better while moving and lifting,
as long as we keep weights moderate, heavy loading doesn't really seem to agree with his back, but I think that makes sense. I think about,
because if you think about the mechanics, so if he has a significant curvature of his spine, being able to brace effectively around that different curvature and being able to stabilize when your spine isn't, vertically up and down, stacked well, I could see how heavy load would irritate that. Mm-hmm. But same thing, motion is lotion. If you're moving on a regular basis, I like that. It's very cheesy.
Saying it.
Matt is going to say it every class.
It's very cheesy. But if movement makes him feel better, keep moving.
Good trainers borrow, great trainers steal.
And I notice that if I don't strength train, my hips get sore. Do you remember a couple months ago, I was my back is killing me, and I hadn't exercised in probably 3 weeks or so. I was I need to do something. So I got on our Rogue Echo bike in the garage and was just I need to move. My back was so sore. So a lot of people, they're I have low back pain, but I don't exercise and I sit all day and I do all this. Maybe that means we need to move.
Yeah.
So if he feels good moving, keep him moving. 100%.
To throw a caveat in there, again, the other things that are going to make it difficult are, does he have a primary curvature and a secondary curvature? Is it just his thoracic spine? Is it?
I'll refer him to you. Let me know.
Let me know. Mike all the questions. There's a lot. Scoliosis, scoliosis that wasn't just diagnosed when you're 8 and you kind of grew out of it. It can be very, very complex.
And the guy loves fitness. He likes doing all sorts of stuff. He'll go to spin groups, yoga. Yoga seems to help him a lot too. But, he likes weightlifting. That's how we met. He wanted to learn to weightlift and all. But I don't want to do anything on accident that leads him getting 10 years now. He talks about, I worked with a trainer for 5 years and it fucked my back up worse because we were doing this. That would be the worst case scenario.
I don't think you necessarily have that to worry about per se.
I mean, hopefully not. I was just wondering if there's anything. Don't do this with scoliosis. People are okay, I won't.
No, because you're creating more resiliency in those tissues. The more that you load those tissues, the more resiliency and the stronger those tissues are going to get.
The one thing that you would want to avoid is feeding into the direction of which he has that curvature, right? So if there's a certain movement that you're doing and it's just again, we talked about rotational, right? And let's say he's got a right curvature, and so if you're doing something and he has to turn to his left repetitively, again, that's feeding into that curvature, right? So you wouldn't really want to do anything to kind of really accentuate that.
Okay,
right?
That makes sense. Yeah, so, I don't think we do, but I wouldn't have thought of it before. That's a good point.
So I wonder if yoga is really helping him or hurting him with all the spinal twisting.
Because mobility, though, yoga is going to give you that mobility. So that would be a great question for Dr. Rachel. She's one of our other chiropractors. She's also going through her 200-hour yoga certification. She might know the answer to that question a little bit better.
Well, I'll refer him to your office and we'll see what he does.
Fair enough.
All right, well, I'll give you one last question, it's not too complicated of one. But training with a belt, pros, cons, goods or bad?
I think it's a great tool. The biggest issue is that it can become a crutch. Right, so
it's not a fashion statement.
That's exactly what I.
If you're you go to a big Globo gym and you see the bodybuilder that's wearing it and it's sucked up real tight and he's wearing it, and he doesn't loosen it throughout his entire workout.
Oh yeah.
Right.
And he walks like this.
In between exercises.
Broad as a house, bro.
You know, he's going from exercise to exercise and exercise, and he doesn't take it off and he doesn't adjust it, then the belt is doing everything, right? So it's more of a crutch. And then the second he's out in his everyday life and, you know, he tries to he's got something on a shelf and it's falling off. He tries to catch it. That quick, sudden reaction, he might blow his back out because he's got no core strength because he hasn't been training, right?
Yep.
It can be a phenomenal training tool to give someone a cue as to how do I brace accordingly, right? And basically, again, you want to be able to fill that belt up and really push against it. Yep. But the belt shouldn't be doing all the work,
right?
And I would also say that, you know, for me, I'll toss it on when I'm getting upwards of like 75%.
Yep.
Level 1 right now.
So I've pretty much, and I've seen, you know, other trainers be like, no one ever needs a belt. And I'm like, you literally just don't know how to use a belt, I would imagine is the reason you're saying that. Because, it would be that. I found it would be very helpful for the cue to push your belly into the belt, and like it would also help them learn to fill what I call filling the tank and brace. Because I would say do the same thing, but without the belt this time. Breathing, you know. And then, like when you get to those very heavy load, I always thought of it as like, hey, this is a just in case, like injury prevention type thing. You know, same with the knee sleeves, you know, that little extra support when you're 90% of your max, more than that, going for a max. You know, when gravity alone can be the thing that hurts you, that's...
Well, when you did that powerlifting competition that our banker was in, tell that story.
Oh, so I had a team that we put together, and it was myself, my brother, 3 chiropractic students at the time,
and our banker.
And it just so happened to be our banker, he was a freaking awesome guy, and he was super jacked, and it was always funny going to visit him because he was huge, and he'd be in his shirt and tie, and his shirt would be, you know, he was like just pushing the shirt to its limits, and I threw it out there. I was like, hey man, do you want to do a powerlifting competition? He goes, yeah, sure, okay. So he comes to the competition, and he freaking I think he benched, you know, 430. And when we're warming up, he's like, it's touch and go, right? We're like, no, like there's commands, like you have to, like, you know, you get it unracked, you get a down call, you get a press call, you get a rack call. And he goes, oh, all right, and he just smashes 430, and then for the deadlift,
wow,
he did. I think he pulled 630, and it was his 3rd attempt, and it was funny because he just ripped it off the ground. It really didn't look like he put much effort into it. And then afterwards, and he did it, you know, no belt, nothing. And then afterwards, myself, my brother, the 3 chiropractic students, we were all wearing our belts, and he's like, "Does it actually make a difference?" And we were like, "Yeah, like you just can create that much more stability." And he goes, "Oh, I think I might have to try that." And I
after he just deadlifted 630.
And I'm not kidding. He picked it up like he was warming up still. It was nuts, and he was just brutal.
I'll get out of the habit of using a belt. I try not to use it more than I have to, and then every once in a while you put it on, especially even when you're tired and you're like winded. You put it on. How much easier? How much lighter? It doesn't even make sense that the bar feels so much lighter. Yeah. And it's tempting to always want to wear it because then it's, you know, less work you have to do. It makes your time a little better, right? The weight's a little heavier.
Oh yeah.
But I don't, because I care about the longevity of my body.
Mm. That's a very good way to put it.
And I don't want to get hurt catching that bookshelf someday.
As it falls on my head.
Right?
Try to save me.
That's like a good conversation piece. I like that it leans so far over.
I didn't really look at it when I went
Don't look at it until it's over.
It's fine.
Sounds good.
Well, I kind of want to wrap it up there, just, you know, respectful of time. It is, you know, I don't know exactly what time, but late enough.
8:24.
8:24. Is there anything else you guys want to add? Say, pitch for your business, you know. You're more than welcome to.
I don't know.
Sarah, I'd love to have you come on again, and we'll talk about I know you do a lot of work with BirthFit and the postpartum pregnancy. I'm not exactly sure. Pregnant women and before and after.
Yep.
Okay.
Women's health.
Women's health. Yes. So we'd love to get you back on, and we'll talk more about that. I know you know Katie Reeves, right? She's one of our trainers here.
Yes, I've met her before.
I know she's very into the BirthFit, and when you guys were talking about having different specialists within your practice, that's something we're hoping to develop some of our coaches into having a specialty, because I'm not, no offense to women anywhere, I'm not that interested in learning everything I need to know about pregnancy and postpartum other than the basic guidelines.
Totally fair.
It's kind of like, hey, if I can get Katie, who's already into that, to be the specialist, it's a lot easier for me to even refer my own clients or a member of the gym to, Katie's the one to talk to about these things. That's kind of my goal in my head. So her, as well as you, if you guys come on and do that conversation another time, we'll set that up. But go ahead. Sorry, I just wanted to throw that out there.
So we are Pinnacle Hill Chiropractic. We're located in Brighton at the corner of Elmwood and South Clinton Avenue, across the street from McQuaid High School. We have 5 chiros and 2 massage therapists, and an awesome movement studio in our lower level, not our basement, our lower level at our office. And we're accepting new patients. So if anybody has any questions, give us a call.
Yeah.
PinnacleHillChiropractic.com.
We are always accepting new patients.
Always.
We do take a few different forms of insurance.
We'll do a complimentary insurance verification if anybody's interested. Yeah. That's about it.
Yeah.
Awesome.
That was our pitch.
No, I think it's great. I think you guys are doing awesome work. It's actually exciting. I've known you guys for a long time. I think you guys were.
Remember when you tore your bicep or your
my pec? Yeah, that was a fun time.
I taped that up. That was pretty fun. That was
glad you enjoyed it. I'll tell you, that was
before we even had our current office. That was like Monroe Avenue office.
The first space.
That was the peak of my strength, and I will never be as strong as I was before I did that.
Don't say that.
I mean, I was benching 365 that day. I'm just not even going to do the work that it requires to get that strong again. but I mean, my deadlift, we talk about like being super strong, and like I just don't think I'd be doing the work. I don't even think it'd be benefiting my body to become that strong again. But that's funny. But I've seen you guys grow your business all the time, and it's so cool to hear you guys talk about all the continuing education development stuff to grow your business, to grow your staff and yourselves like that. That's the kind of shit I love, and I love being around people that are like that. So. Big kudos.
Thanks.
Yeah.
Is there anything you want to say? No?
All right. I'm already a patient, so.
Yeah. I mean, I always feel like I should come back just to get like checked in. Like, I feel great, but feel me out. Like, am I great?
What's up? What's going on here?
What's wrong with me here?
There's the old saying, what is it? The absence of symptoms is not the definition of health. Or
exactly,
along those lines, basically.
Yeah,
so, we could maybe find some holes or some, deficiencies or dysfunction or whatnot.
Yeah, I'm sure we could find some deficiencies and dysfunction in this body. This body's like a temple that I throw sweet parties in. You know what I mean? Like, it's been around. It's seen some things, but it's still held together strong, All right, thanks a lot so much for coming on, guys.
Thanks for having us.
I'll have you on soon.